Welcome and thank you for joining this presentation on the CMS Star Ratings. My name is Lisa Trundy-Whitten. I'm a principal in the Senior Living Practice Group at BerryDunn, and I'm joined by my colleague, Olga Gross-Balzano, a Senior Manager in the Senior Living Practice Group as well. So why are we talking about star ratings and staffings together? In December 2020, Care Compare replaced the Nursing Home Compare, and this new website allows consumers to search facilities by their CMS star ratings. And facilities really need to understand how their day-to-day operations can impact their star ratings. Let's start with labor. So labor is the highest nursing facility expense. Labor-related costs, including contract labor, employee benefits, represent between 48 and 53% of the costs reported on Medicare cost reports. According to the Bureau of Labor Statistics, at least 2.5 million more workers will be needed by 2030 to care for the so-called silver tsunami. 1.2 million of those workers are mostly CNAs, aides, and registered nurses, and those will be needed before 2025. Nursing home staffing demand is expected to grow by 20% before 2030. So understanding your star ratings and balancing your staffing needs are vital to maintaining a healthy bottom line. Also, margins from patient service revenue are negative. Across the nation, losses from patient care have increased from 2016 to 2020. In the Northeast alone, the loss from patient care increased by 17% from 2016 to 2020. Wages are increasing. We see across our region that the minimum wages are increasing. COVID has led to increased wages and additional pays that aren't being fully covered by the reimbursement rate. And we're seeing a growing use in agency staffing. Care Compare went live in December of 2020, and it differs from Nursing Home Care Compare. The star ratings, here's a look at what you might see when you look at Care Compare. So star ratings range from 1 to 5, 5 being the highest quality rating. It's a consumer-focused website, so consumers have the option to select only the highest rated facilities based on the stars, and that might mean your facility doesn't make it into their search. The data is updated regularly and frequently, so it's more difficult for providers to stay up to date on the ratings. CMS did implement changes and revisions to the data effective January 1st, 2021. So there's some new data out there. So the objective of this presentation today is to help you understand how the star ratings are calculated and share some thoughts on balancing star ratings with your bottom line. The charts and data summaries that we use for this presentation come from the Care Compare survey findings data and the payroll-based journal report, or PBJ, provider submitted censuses and labor data. We do remove, as part of this data, we've removed outliers, and the data has been updated on March 31st through March 1st, 2021 with what was released on March 31st, 2021. CMS star ratings are assigned in 4 categories. There's their overall rating, and then there's health inspections, and those are based on annual inspections, complaints, and investigations. The third category is staffing, and that's based on a ratio of nursing staff hours to residents. And the fourth category is quality of resident care, which is based on MDS and claims-based measures. Olga is now going to take us on a deeper dive into the calculation of each component of the overall rating and focusing on the impact of staffing has on your rating.
All right, so as Lisa mentioned, the highest rating any facility can get is 5 stars. Let's take a look how CMS assigns the overall star rating. It takes 5 steps. First step, they start with the health inspection rating. Then second step, they add 1 star. If your staffing rating is really good, it's 4 or 5 stars, and if it's greater than your health inspection ratings. However, if your staffing is really poor and you only have 1 star for staffing, it's a subtraction of 1 point. In step 3, 1 star is added if the quality of resident care rating is 5 stars. And also, if your quality of resident care ratings are poor and you only have 1 star, then there's a subtraction of 1 star. In step 4, if the health inspection rating is only 1 star, then overall facility rating could not exceed 2 stars. Step 5, they also look at special focus facilities, and if so, then all star ratings are suppressed. And with that, we will move to the next slide. Now let's take a look at health inspection scores. As Lisa mentioned, health inspection scores are based on standard inspections, your annual surveys, complaints or self-reported incident, and also infection control and prevention standard inspections. CMS currently calculates health inspection score based on 3-year look back, and all citations identified on any and all of those surveys are considered. Then higher weight is given to most recent inspections, and then facility gets a little different scoring if previous survey findings were not corrected on the most recent surveys. CMS assigns total points from all surveys for the following manner. So top 10% of nursing homes with the lowest health inspection scores in each state get health inspection rating of 5 stars. Then the middle groups, about 70% of all nursing facilities, get ratings from 2 to 4 stars. Almost equal number of nursing homes in each rating category. The bottom 20% of all facilities get 1 star rating. And we will move to next slide. Quality of resident care star ratings based on 17 quality measures to create 3 quality of resident care ratings. Short stay quality measures, long stay, and overall rating. These quality measures are derived from 2 data sources: clinical data reported by nursing homes, your MDS assessments, and your Medicare claims data submitted for payment. CMS calculates ratings for quality measures using 4 most recent quarters for which data is available. Nursing home received points based on how they perform on each quality measure. The points for each measure, short stay, long stay, and overall, are totaled, and the nursing home is assigned ratings based on thresholds for each of those rating categories. We should note that there have been some changes in data that's used by CMS and some exclusions and amendments to star rating assignments that they started implementing as of January 1st. As we discussed, each nursing home electronically reports staffing hours to CMS through payroll-based journal system. And then CMS calculates a ratio of staffing hours per patient days. The staffing rating is based on 2 measures. First one is registered nurse hours per patient day, and second one is total staffing hours per resident day. Your total staffing would include your registered nurse time, licensed practical nurse, and your nursing aides, CNAs. Staffing data is adjusted for the needs of nursing home residents. For each registered nurse, staffing and total staffing, 1 to 5 star rating is assigned according to thresholds established for each of those categories. These ratings are then combined to assign overall staffing rating. For example, to get an overall staffing rating of 5 stars, facility needs to have 5 stars on both RN and total staffing. If there's, so normally it's an average of 2, but if there's some rounding included, then CMS leans more heavily towards registered nurse staff. And so if your registered nurse staffing has higher rating, your overall staffing would be a little higher. Starting with April of 2021, nursing homes that did not report staffing data for the fourth quarter of 2020, or that had 4 or more days in the quarter with no registered nurse time, will have their staffing ratings reduced to 1 star. So it is very important for you to know that you may be assigned 1 star rating if you did not have registered nurse on site every day, you did not submit staffing data, or your data could not be verified. Let's take a closer look at staffing hours. Staffing hours per resident day are calculated based on facility reported data from payroll-based journal. It is the total number of hours worked by staff members divided by the total number of residents. And these are referred to as unadjusted hours per patient day. Next slide. Actually, Lisa, can we go back one? Thank you. Then CMS adjusts the reported staffing ratios for case mix using resource utilization groups, or RUG-4 case mix system. These are referred to as case mix adjusted hours. Case mix index, or CMI, is a numerical representation of residents' care needs complexity calculated by minimum data set, MDS assessment. Patients requiring more staff assistance have a higher score, and adjusting hours by CMI allows for comparison of efficiency between facilities with varying patient demographics. And finally, CMS takes case mix adjusted staffing hours per patient day and multiplies them by the national average hours. They are updated quarterly. And Lisa pointed out that data in Care Compare is updated frequently and regularly. And this national updates also added frequently. As discussed previously, the overall staffing ratings is based on combination of registered nurse and total care staffing ratings. In most cases, the overall staffing rating is an arithmetic average of the two. So as an example, what do you need to do to earn 5 stars? Well, your overall staffing needs to be over 4 hours of case mix adjusted hours per patient day. Of those 4 hours, or actually over 1 hour should be registered nurse time.
Thank you, Olga. That was an excellent presentation. Facilities require adequate staffing to meet their patient needs. That we know that. The industry best practice is to adjust staffing based on census and the needs of the patients. But what we want to avoid is excessive staffing, because that can lead to lost productivity, drive costs up, and continue to diminish the margins that we're seeing. Some key recommendations and takeaways from this presentation are to review your MBS scoring regularly and frequently, and use that to adjust your staffing. Review and verify your data. Review your star ratings monthly or at least quarterly. and check for any unexpected changes. That could mean there's an error in your submission. Review your MDS and PBJ, your payroll-based journal submissions, to make sure that the data is accurate. Make sure that your filings are done timely so you don't miss the deadlines in the reporting. And compare yourself to your peers. And that means apples to apples. Make sure you know that you're comparing yourself to peers in the same geographic area, the same ownership type. Note that staffing hour requirements may change from state to state based on specific regulations. So make sure you understand the difference in those. So the bottom line is facilities need to consider their patient care needs when developing and adjusting schedules. But it's not just the number of patients or the residents in their facilities, it's also their clinical needs. So building a high-performing workforce culture and implementing staffing tools will help you to gain efficiencies, reduce costs, and produce quality outcomes for your facility. Facilities that have a strong culture and workforce will be the facilities that are successful in the future. So thank you for joining us today. We hope we were able to provide you with some information and tools you can use or implement immediately. If you have follow-up questions or would like more information, our contact information is on the last slide. Thank you for joining us today.